My name is Gabby. I'm from Brentwood, California. My right breast is very high, close to my collarbone, and my left breast sags, just like drooping down in the dumps. I was born with a benign cyst in my right armpit. It was removed when I was 2 months old. So after my surgery, this arm had to be pinned down to keep the sutures from opening. When I was a toddler, it took me a little bit longer to learn how to walk because I would be off balance because this arm was stronger and this one was a little atrophied from having to be pinned. It wasn't until my junior year that things started moving along for me in the boob department. Woohoo! My breast did start developing, so it was budding on one side and the other side wouldn't bud. Because when they went in and they removed that cyst, they also removed the breast tissue, the mammary tissue, and the axillary area of my chest. So I'm like hiding in the corners, It's like, nobody look at me. When I was 21, I had an expander placed on my right side, and every couple weeks they injected saline, and then I had the surgery to place the implant where the expander had been and lift the left side and reduce it so that it would match this side. When I got out of surgery, I felt like I got butchered. It was devastating. And I've been living with this for 8 years. Now I tape my nipple because it will come out of my bra like a little groundhog to be like, hi, good morning. Oh,
Nobody believes you.
Ian is my husband and my best friend. He really helps me stay positive, and he tells me I deserve to sparkle all the time. That's a first.
Oh. The things I love about Gabby is that she's a big goofball and that she's stubborn. Something I love about her, but also something that drives me nuts.
My dad used to take me to the park, and then we did free throw, 3-point, so I was building muscle and strength.
Do you think that made you more competitive in life?
Yeah, I think that's what made me so good in the military.
I was in the Army for just under 8 years. Everyone was wearing the same thing, so it really did kind of just help put my breast issues in the back of my mind.
You feel pretty good about Dr. Dubrow and Dr. Nassif's office, right?
I feel pretty confident that at least I know that they're gonna give me an honest answer. Be like, yeah, you got everything wrong with you, but that's okay. And I'll be like, all right, let's go.
Now that I'm out of the military, I'm wearing civilian clothes all day, every day. And that's why now I've decided that it's time to do something about my breasts.
I love you.
I love you too.
I put the Bitmoji app on your phone. So I'm making a Bitmoji of me, you make a Bitmoji of you.
Bitmoji, isn't that like a caricature of you? I just hope there's an avatar that showcases my Lebanese good looks.
I'll show you mine, you show me yours. Ready?
Okay, 1, 2, 3.
Oh, please.
Look at you.
Look at you, don't look at me. That's you?
And that's you. These avatars look just like Terry. They have enormous heads.
Gabrielle has a very complicated situation where she was born with a cystic type tumor in her right chest. So she then developed a situation where the very large left breast and undeveloped right breast.
Can you please send in Gabriella?
Hi.
Gabriella, Dr. Nassif.
Good to meet you, doctor.
Hi, Gabrielle. Terry Dubrow.
Nice to meet you, doctor.
I'm hoping that Dr. Dubrow and Dr. Nassif could help me with the symmetry, especially like the nipple placement. And I don't know, I just want to feel sexy too.
Let's talk about the fact that you had a chest issue. At some point, you decided to do something about it.
Yes.
And what did they tell you?
They said that they were gonna have to get a tissue expander, and then afterwards, we're gonna lift this side and then put an implant here.
And then what happened?
This one never fell, and they told me it was because I didn't massage my breast enough. It's like, you should just be happy that you look good with your clothes on. And I was like, I don't.
I hate it when a doctor blames the patient for a complication. The doctor has to take responsibility for everything.
By the way, you haven't mentioned the fact that your right nipple is way over.
Oh, yeah.
Is that something that you hope will be fixed?
Like, it would make me so happy, but at this point, I don't want to expect too much. But if you can do it, do it. I have one nipple that goes this way, one nipple that goes this way. Reach for the sky.
So what did you think the first time you saw it?
I was in it with Gabby for the long haul, so that's just how she was. Didn't bother me any.
When did you guys start going out?
When he joined the Marine Corps.
Did you enjoy your time in the Marine Corps?
I loved the Marine Corps.
Do you have a Semper Fi thing happening?
I do have a little Marine Corps tattoo.
You
yes.
do? Where? That's a serious tattoo. I never got any tattoos on myself because you know what they say, don't mess with perfection. You were cool with him being in the military, you liked it.
I actually joined the military.
How long were you in the military for?
7.5 years. I was medically discharged. I was diagnosed bipolar.
Oh, okay.
And so I can't carry a weapon, so I'm combat ineffective. I cannot be deployed.
We have to talk about that because just like in the military, when you have a psychiatric disorder, there's concerns. That's as big a concern in plastic surgery. And so, what's going on with your bipolar disorder right now?
I'm actually like in the best place that I've been in a long time.
So let's say you had surgery. What happens if it just doesn't come out that great?
What if it's worse?
I have him.
Okay.
I have my psychiatrist I can call when I need. There's help numbers and resources.
Did they put you on medication for bipolar disorder?
Yes.
What did they put you on?
Lithium, Lamictal, Xanax, and Zoloft.
Okay, are you currently on those medications?
Yes.
Are you under the care of a psychiatrist right now?
Yes.
Okay. It's quite a relief to see that Gabby's in a good place emotionally right now because the last thing you want to do is have a good surgical outcome and a bad emotional outcome, and Gabby's at risk for that. That's good. You said all the right things. Let's go in and do a very careful physical exam and try to figure out realistically how much better we can make this look, okay?
Okay.
Let's go. So let's look what's going on your left side first. Interesting thing about this breast is it's kind of a nice breast. It could use a little bit of upper fullness. The nipple's a little high. The question is, why is this implant so high? Why does it not fill out this outer portion? And why is this areola over this way so far?
Does she have a capsule?
No, she doesn't. You just have fundamentally a lack of tissue, which is harder to solve than scar tissue. You have a complication due to this original surgery you had in your first year of life that has altered the development of this breast. Gabby's lack of tissue and movable muscle makes it extremely difficult to give her a good symmetrical result. I know she's expecting a good outcome, but I'll be honest with you, I'm not sure that's possible. To go to medical school, you basically have to get 93% or better on every test you take. I think I can give you somewhere in the 70s in terms of an improvement.
I see you getting about a good C+, actually.
I have high hopes that he'll raise his GPA a little bit.
I have to say it, I know you guys hear this all the time, but thank you for your service. Maybe we can be of service to you guys.
Thank you.
Thank you.
What do you think it's gonna be like?
Probably like a surgery, if I had to guess. Probably gonna have doctors and stuff there, and maybe a little machine that goes bing.
Today is the turning point of my life. I'm just gonna be sitting at home going like this, saying like, oh my gosh, this is so not real. And then I'll be like, well, they're not real, so. But they feel good.
Hey guys, the one thing I need to ask you is what are we doing about size? Or are you saying, hint, hint, do whatever you need to do?
I trust you.
Okay, so you're giving me a little bit of leeway to get good symmetry and good shape and do all that. For Gabby's surgery today, I will start by removing her right implant and then explore her pocket for the source of her neuralgia. I will remove scar tissue to open up the outer side of the breast pocket to allow for more side fullness before inserting a new implant. Moving on to the left, I'll reduce the width of her breast, lower the areola, and raise the bottom of the inferior portion. I'll then insert an implant, and hopefully Gabby will have two symmetrical breasts.
Hello, Dr.
How are you?
How are you, sir?
Gabby, how are you?
After surgery, I had a hamburger. It was so delicious. Not only did I have the surgery of my dreams, I had the hamburger of my dreams.
So, my goal was to assess the pocket, see how much scarring there is, and see if I could pop out that outer portion. I put a 400cc implant in your right, a 215cc implant in your left. So let's see how well I did. So now's the moment of truth. I did everything I could, but the question is, was it enough? Did I pass this test? Look at that.
That's fantastic.
Yeah, overall not bad.
Really?
The big question is the nipple alive? Yes, the nipple's alive. I think I got an A on this test. I really do. Do you hate it?
She's happy.
It changed my life. I've been dealing with my abnormal breast situation since I was 2 months old. Dr. Dubrow doesn't just change lives. I feel like, in a way, he created a new one for me.
Thank you for your service, and we're able to thank you with our service.
Congratulations.
You're welcome.
Thank you for all your help. I really appreciate it.
My pleasure.
Can I get a whiskey sour?
Whiskey sour?
Nice.
When I was in my military uniform, it was really easy for me to just hide by putting on a sports bra, adjusting my uniform so it's nice and loose in the front, and that's not the case anymore. Ian has never seen me wear anything like this before, so we'll see if he blushes.
You look beautiful.
Hi.
It took all my self-control not to yell, "Ooh, God." I've never seen this dress on you before.
That's because I couldn't wear a dress like this before. Like, I was amazed when I first tried it on. I was teary-eyed, but also in disbelief. Like, what's wrong with the marrow?
Things I never thought would look good on me work. No rationalizations. Gonna look saucy today.
I know every time we get in the car now, I have to adjust the mirror away from you so we don't get in an accident.
I don't blame you.
It makes me feel great to see Gabby so happy. You know, she's the other half to my life, so when she's bummed out, it's something I want to help her with, and with how it was, that wasn't something I could help her with.
Well, it's time to dance. You ready?
Before my surgery, my breasts were completely lopsided. My nipples were facing everywhere. But now, thanks to Dr. Dubrow, I have symmetrical breasts with nipples facing in the same direction. I feel like a unicorn. No more Franken titties.
You ready to be dipped?
Yes.
One.
I took the initiative. You hesitated too long.
And we can stay out all night and just dance the night away and have fun. Doing the dirty. I'm just kidding. Love you.
I love your tools.